Hello, and welcome to Barca Infomedics. Our question for today is, in this program we will talk about type 3 diabetes. Type 3 diabetes is not an official diagnosis or recognized disease, but scientists have found a connection between Alzheimer's dementia and diabetes. Alzheimer's dementia is a kind of brain degeneration in which the patient cannot remember things and is unable to understand anything to the extent that they even forget to eat. Eventually, such patients die. Alzheimer's dementia and diabetes share characteristics like insulin resistance. What is insulin's role? Insulin regulates glucose in the body, and in the brain, it supports memory and learning. Regarding brain insulin resistance, scientists believe the insulin resistance causing type 2 diabetes also gradually reduces memory and learning in diabetic patients. What's the connection between Alzheimer's and diabetes? Research shows that in patients, scientists believe that insulin resistance, which is the main reason or cause for diabetes in patients with type 2 diabetes, is the same insulin resistance that gradually reduces memory and learning abilities in diabetic patients. What is the connection between Alzheimer's dementia and diabetes? Research has shown that certain characteristics are observed in patients. Diabetes patients are at risk of developing dementia, and the main reason for this is insulin resistance. In such patients, the progression of Alzheimer's dementia in the brain increases day by day. There is also a genetic problem or gene defect, one gene called ApoE4, which is a variant associated with an increased risk of Alzheimer's dementia. The presence of this gene in the body lose the ability to function, gradually lose it, damage brain cells, and eventually the brain cells die, and slowly the brain starts to deteriorate. The benefits of this research are that, since the link between insulin and Alzheimer's in the brain has been established, medicines can be developed by targeting insulin signaling, and this research is ongoing. Early intervention, that is, at the initial essay, gradually the brain starts to deteriorate. The benefits of this research are that, since the connection between insulin and Alzheimer's in the brain has been proven, medicines can be developed by targeting insulin signaling, and this research is ongoing. Early intervention, that is, at the very beginning, can help halt the progression of the disease. By detecting the disease early, the dangerous progression of Alzheimer's and dementia can be slowed down, and with preventive measures, patients can be completely protected from dementia. An important note is that type 3 diabetes is not an official type of diabetes yet. More research is still needed to understand the relationship between insulin and brain health in Alzheimer's and dementia.